This is Mumbai On Demand with Annie.
It is the only request show on 94.3 Radio 1, and this is a segment we're running every single day, 2 to 3. It's called Health Potion, brought to you by Hinduja Healthcare Surgical Car. Today we are going to talk about bariatric surgery. More so, obesity. That's something that we will touch upon. One of the pioneers in laparoscopic bariatric surgery, practicing for the past 25 years and also consulting with the Hinduja Healthcare Surgical Car. He's been a pioneer in laparoscopic sleeve gastrectomy in Asia and has one of the highest experiences of more than 5,000 successful bariatric surgeries. His name is Dr. Shashank Shah. A very warm welcome, Doc.
Good afternoon. How are you?
Very good. Now, 25 years is a long time. What is the kind of risks you have seen as well as growth in a bad way, if I can say so, when it comes to numbers in obesity in India as compared to the West?
The numbers have been growing. Maybe 25 years back, we just had a glimpse that, yes, this is a branch where skill is required. The numbers have been getting doubled every 5 years since then. And now I almost have to quit rest of my practice because the numbers to attain obese and diabetics is so high.
Ooh, that is definitely not good news. So let's get straight to the point. Does obesity lead to diabetes?
Yes.
Okay.
Obesity is a major associate of type 2 diabetes, and the fat in the body blocks insulin, which is called insulin resistance, and over time does make the pancreas disease. So almost 80 to 90% of patients with type 2 diabetes have some grade of obesity and need treatment for the same.
Okay. How can weight gain due to diabetes be treated since patients with diabetes always feel hungry?
Very true. Many of the anti-diabetic medications have a tendency of inducing weight gain. Sometimes the blood sugar goes down or a patient has fear of hypoglycemia. They eat more. And unfortunately, there are various hormones in the body which get disturbed with diabetes and insulin axis, which give rise to more hunger, more craving, and it's very difficult for the person when actually the internal hormonal profile is asking for food or driving that person to be hungry. Unfortunate challenges of a patient with diabetes who's gaining weight.
Right. What would you want to say to people who just want to push aside the fact that your diet has to be correct and that has to start at a very young age and not after you have been detected with a particular disease, especially diabetes?
Yes, I think those who have family history of diabetes or obesity in the family have to develop a culture of enjoying without very high calorie food very frequently.
Correct.
It has to happen in the society as a culture. However, everyone does need to enjoy food. Hunger needs to be satisfied. So I wouldn't blame anyone who feels hungry and wants to eat.
Right.
However, prevention is always better than cure. And the moment you find that you are gaining 4-5 kgs more than ideal, I think that's the ideal most point where one can aggressively act. Once you gain more than 15 kilograms of weight, your metabolism does get diseased in such a way that every attempt to lose weight is destroyed by the body's physiology.
Correct. Now, he was the one who started the first bariatric training center for bariatric surgery in India and also recently won the Vivian Fonseca Award awarded by ADA, and he has been the first surgeon ever to receive it. It's only a pleasure and honor to be in a chat with him. Dr. Shah has already mentioned that yes, it is difficult for diabetic patients not to control their craving, but as much as he says that it has to be part of your culture, especially if you see that there has been a history of diabetes or obesity in the family. Now, Dr. Shah, can insulin be avoided in obese diabetic individuals with obesity surgery?
Yes. Obesity surgery, which is actually called a metabolic surgery, which improves metabolism of patients with obesity and type 2 diabetes.
Right.
Most of them, almost 99% of them, are off insulin by the time they leave the hospital because there are internal inherent hormonal actions of these procedures which improve secretion of insulin by pancreas instantly, as well as they reduce the insulin resistance. They were making the body's insulin effective. So I would say it's a blessing in this era because no one likes to take insulin. There is a risk of blood sugar dropping down, and everyone would like to live free of any injections or pricks.
Right, absolutely. So can diabetes then be reversed?
Yes. Fortunately, in this today's era, diabetes can be reversed both by medical treatment as well as surgical treatment. There are reports which suggest that if you treat diabetes aggressively within first 6 months to 1 year by low-calorie diet activity, you may be able to reverse your diabetes.
Wow.
However, if you have still crossed that, and you still have type 2 diabetes, the award given by American Diabetes Association does state that there is a possibility, an opportunity for every patient with type 2 diabetes to reverse their diabetes by metabolic surgery, in which the procedure is done on stomach intestine in such a way that production of fat and glucose from the food absorbed is minimized, thereby normalizing the metabolism, improving the insulin action, and making the patient live with normal blood sugar and reasonably normal diet and life.
Wow. Must say that technology, innovation and science has indeed grown in the past decades. And I'm sure, Doctor, from the time you started practicing 25 years ago to now, you have seen a sea change in the way it has developed. What do you have to say about today's technology when it comes to approaching bariatric surgery or diabetes or obesity?
I would only say that the word surgery was very scary. Today it's hardly a surgery. It's stitchless, painless, fearless daycare, and advances in science understanding has given this opportunity that every abdominal procedure today can be minimally invasive, stitchless, scarless, and the person can be pain-free and resume his work as soon as possible and live a healthy and happy life.
That is wonderful. Thank you so much. It's a way of building hope in a lot of people who are already on their way to obesity. And for the others who are fearful of it, I think it is only also giving them or showing them the path that if in case there is a situation in the family, then there is always an answer to it and then there is help that is at hand. Thank you so much, Dr. Shah. It was simply wonderful talking to you.
Thank you. Have a good day.
Dr. Shashank Shah, consultant bariatric surgery with Hinduja Healthcare Surgical Car. This is Mumbai On Demand with me, Annie, 94.3 Radio 1.